Nurses, doctors at Reddit, what's the rarest least common medication you've ever had to administer and why? In 15 years of hospital pharmacy, I've twice had occasion to dispense thalidomide. It's used as an end-stage anti-nausea med and comes very carefully packed with all sorts of warnings about not coming near it if pregnant, and even has little pictures of thalidomide babies. My dad was one of the few in Norway affected by thalidomide. He got off really lucky with just some missing very short fingers. Could not get into the army despite being a good shooter. Any damage to the other hand would render him disabled and the army would not risk it. Pharmacist here and leeches. We use them to keep blood flowing if you get a finger or ear or something cut off and sewn back on. I was told recently that a medical grade leech costs $42. Also, clinicians should not bring their own from home. I would have assumed that went without saying, but apparently not. I had a woman who was on ziconotide, which is an analgesic derived from cone snail venom. If it isn't administered correctly, through the spine, it causes hallucinations. At some points in history a scientist was like, damn it. Whether I snort, drink, inject, or jam this cone snail venom up my ass, I always hallucinate. Bob, get over here, put it through my spine. Activated protein C. Can't remember exactly, but it was about your acute 50k dose. Used in severe last ditch sepsis treatment. Not a vial you want to drop. Zigris. Had administered it as well in the US when working in critical care. It was pulled from the markets here in 2012 or so. I gave an old man a M&M one time when he was demanding a sleeping pill. Blood pressure was too low, so doctor wouldn't order a real one. Worked great. Edit. Getting comments that this is unethical. Please realize that this was done with the patient's safety in mind. In a real world hospital, safety is always the first priority. Things aren't always as clean, neat, perfect, and morally sound as they are on Grey's Anatomy. Also, I've done this maybe twice in 11 years. This isn't common practice and it has happened in very, very special circumstances when the family has been aware and encourage it. I don't just go around lying to patients and giving candy instead of medicine on a daily basis. Methylene Blue. I gave it to a girl who tried overdosing on Oragel. The active ingredient is benzocaine, which caused her to develop a methemoglobinemia. Treated with the blue drug. It truly is an artificial looking bright blue and I gave it to her in her IV. Pharmacist here. That showed up a few times as a drug, which always made me chuckle because for so long in my head it was just something used to stain bacteria. Now I use it to stabilize technetium-99 meters hexametazine. Methylene Blue really has run a wide gamut as far as spheres in which it's found use. Double quote. A poop fecal transplantation. At my first internship during nursing school, there was a patient with a bowel infection caused by Clostridium difficile. A few months before he got treated with broad-spectrum antibiotics for a pneumonia, which caused the infection. They tried other treatments to cure the infection, but nothing worked. Eventually, the patient got accepted in a clinic trial for a fecal transplant. One of his kids was the poop donor. After the transplantation, the infection actually cleared up. Vodka. Because of methanol poisoning. I was going to say the most surprising thing I saw in the fridge in the med room was a can of beer, labeled PRNQD, and chilled for the patient. Maggots. We had a drug addict come in who had let an infection go so long in his arm from repeated needle usage that all our attempts to clean it failed. We ended up using maggots to eat away the dead tissue, while leaving the healthy tissue intact. Dude just had an open wound full of maggots loosely covered in some gauze for like several days. The worst part is always having to collect them afterward. The medication most people are shocked by is cocaine hydrochloride. Yep. Cocaine. It's a good vasoconstriction agent. And topical anesthetic. Respiratory therapist. I gave nebulized morphine to a sweet old lady who was dying very painfully in front of her family. There were about 12 of us in the room including me. The PA fought a pulmonary group that was covering the ICU for the weekend that ordered it and her family. 12 of us in a tiny room. I didn't think about it at the time because I was very concerned about it being out of my scope of practice, and because it was the weekend I didn't have a chain of command to really ask. But you know, nebulizing an opiate in a tiny room with a lot of people. When the PA and I came out after 4 minutes and the treatment was finished, I said I felt kind of funny, and the PA laughed kind of weakly, then sat down. My pupils were pinpoint. We also used to nebulize vodka for pulmonary edema, although I've never done it so can't vouch for it. Niku nurse here. Aminal. I've had to give it to 2 different patients. It's a medication to help with really high blood ammonia levels with kids who have certain metabolic conditions. The medication is extremely expensive. It was many years ago and I was working with end-stage cancer patients. This one woman, who began her treatment outside of the United States, was given a mixture of cocaine, heroin, alcohol, morphine, phenothiazine and some other antiemetics. It was specially made into a liquid and imported from somewhere in Europe. I remember this med so vividly because it's not every day you give someone heroin. I think it was called something like Brompton cocktail, and the lengths that were gone to check out and administer a dose of that stuff. We're talking who's got the nuclear codes type of system. I have to admit though, it worked like magic. Medical maggots to chew up the dead tissue off a diabetic patient's foot. I was an intern when my attending wanted to use maggots on a patient. The nurses refused to change the dressing and would page me to do it. The PT said he would hear chewing in the middle of the night and that his foot kind of tickled. Known. Just a med student and not sure how rare it actually is. But I've seen arsenic trioxide prescribed once for a patient with acute promyelocytic leukemia. I think another arsenic compound is used to treat sleeping sickness, but that's about the only diseases it's used for these days. Once upon a time it was the best treatment we had for syphilis. I'm a pharmacist in Australia and have worked in a couple hospitals and cancer care wards. From what I've seen, we actually get quite a lot of leukemia patients requiring arsenic trioxide as part of their chemo protocol. I had 2 patients just a couple weeks ago and I honestly never realized it was even used when I was a student. Pretty amazing that we can use such toxic compounds to treat cancers and save the patient. Not a doctor or nurse but analytical chemist for a small-scale bespoke pharmaceuticals production company. Had to stock control our CDs, control drugs, and dispose of about 10 grams of out-of-date pharma-grade cocaine hydrochloride that had been used once. Apparently it can be prescribed as a mouthwash for numbing the gums. Not me. But one of my nursing professors told the story of an alcoholic who was so deep into his addiction that the doctor prescribed a cup of wine every 8 or 12 hours or something to keep him from going into fatal withdrawals. Naturally, the hospital did not spring for a nice bottle. The same happens with GHB addiction in my country. The addict himself has to bring in the GHB needed to taper. Synthetic blood. Melbourne, Australia. And I think it was a world first at the time. We had a trauma patient who required a blood transfusion. She couldn't accept blood products, however, due to her religious beliefs. So synthetic blood was shipped in from the US. Ended up saving her life. We hadn't heard of synthetic blood. So it was kinda bizarre. This was a few years ago. So I'm not sure if it's more widely used now, but I've not seen it since. I had a wealthy patient who paid $70,000 on his Amex Platinum card for a 1-month supply of Harvoni, Hep C, for him and his wife. That was not even enough for full treatment. That was the cost every month for 3 months. He told me he had gotten Hep C from an escort. That is one expensive romp he had. Some metabolic diseases are extremely rare, but can be treated by replacing whatever enzyme is missing. I've prescribed idursulfase for a Hunter R syndrome. It was something like $250 per month and was covered by the state. By far not a doctor, but a relative of mine had a lot of problem with allergic reactions, especially on the skin, where weird looking welts would form. After about a year of trying out treatments, they eventually used a medication of which the basic component are ovaries of a hamster. They had to repeat giving him those syringes a few times, but then it was successfully treated. Sounds like urticaria, hives, which is an allergic type reaction. Omalizumab is a drug that can be used to treat it and is produced in bioreactors from Chinese hamster ovary tissue like a lot of other similar drugs are. It works by blocking Ig receptors, therefore reducing histamine, so is an indirect antihistamine. I take GHB, as in the data pay drug. It's called Xyrem and is used for narcolepsy. It also costs $10. $0 a month without insurance. Bloody hell. I never knew rapists were making such a financial commitment. Ig. It's hella expensive and only necessary for certain autoimmune issues. I think I gave it for Guillain-Barré syndrome, but this was like 6 years ago. Each bottle is $20k I think. My son has had Ivig 5 times at $25k a pop. He now takes an immune suppressant that costs $1,200 a month that seems to be holding him. Thankfully we are Canadian. Cocaine. Baby. For a bad nosebleed. Wait, what? Cocaine stops nosebleeds? I get pretty bad nosebleed during allergy season. Maybe I should try cocaine. Obligatory, not a doctor, but I realized recently I was laboring under the delusion that fentanyl was 100% illegal when I was given some in the IQ. Lem tell you that gave me pause in the middle of a high fever. When I was getting a colonoscopy, I remember the drugs they gave me said fentanyl or had fentanyl in the name on the vial as they were administering it to me. I was like, huh, that's interesting, and then 5 seconds later completely FK'd out of my mind, lol. Probably the hemophiliac medications. There was one that ran in a family and required a medication to be push IV. 50 mls. 1q 6 seconds. I work in cardiac surgery. I've had to give prothrombin complex concentrates to reverse anticoagulation. It's like $6,000 per dose. Prothrombin complex sells for $373 in India. Quite a difference in price. My co-worker had to use something called hyaluronidase recently. It's given subq when vancomycin infiltrates in an IV, meaning that it gets out of the vein and starts pooling in the local tissue. Vanco is toxic at higher levels and it kills the tissue. So when this happens, you have to give multiple small doses of this drug with a tiny needle into the surrounding tissue to break down the vanco and save the tissue. Hyaluronidase is also used to dissolve bad face veneers, lip filler and stuff, if they turn out wonky or, more serious, if they are injected into a blood vessel, which can cause necrosis. Was a traveling nurse in AZ years ago. Had a kid stung by a scorpion. They flew in an antidote from they were developing to give to the kid. I didn't give it. The doc did. It was treated like some kind of liquid gold. Milnacipral for trypanosomiasis, sleeping sickness. Arsenic compound. Was shipped directly from WHO headquarters to us. The patient had to be loaded with prednisolone due to toxicity, and we had to remove the peripheral catheter after each dose since it supposedly would react with and destroy the plastic. Totally wild. I've gotten to give rattlesnake antivenin 3 times. Basically my former hospital would stabilize the body by giving the initial doses of antivenin and the ED. Then send them to my unit. Then I will base the decision for additional doses on my assessment of any symptoms plus a call to poison control plus written protocol. It was interesting, scary, because after the protocol was initiated it was up to my nursing judgment whether to give more antivenin or not. Which is how any protocol works. But it was just weird following one with such an uncommon expensive $3k plus med. Botulinum antitoxin. Cost about $15k 20 years ago. The vial came from the CDC and contained 4 doses. The nurse delivered the first dose and threw the rest away, not understanding there were no other single-use vials. I'm only a pharmacy technician, but we had one patient who needed a hydrochloric acid drip. If I remember correctly. I had never seen it before and the pharmacist had to make sure it was in a metal container and delivered via a reinforced line, maybe glass. It was a long time ago. Aside from that, the rarest drug I've actually had to compound has probably been Xentra, prothrombin complex concentrate, For bleeding. As a nurse, I'd say working with milrinone, a continuous IV med to treat heart failure. It's a last ditch effort. They have to wear a pump constantly, and if it stops infusing you have just a few minutes to get it going again, otherwise their CHF symptoms hit suddenly and you better be on the phone to 911. Did not enjoy. As a vet assistant, wasn't an actual registered tech, vodka IV for a cat that drank antifreeze. Just straight vodka. I'm a licensed vet tech. We keep high-end vodka in our Omnisol for this reason. Only ever seen it used once though. A long time ago, 30 years before I qualified and was still in school, we had a patient on the internal medicine service that was suspected of having sarcoidosis. There was an old test called ACVEM test, ACVEM Silsbach Nickerson test. Basically the test involved injecting a small blob of material taken from the spleen of a patient with known sarcoidosis into the skin of a patient suspected to have the disease. If non-caseating granulomas later formed there, 4-6 weeks later, then the test is positive the patient has sarcoidosis. It was a finicky test and subject to false negatives. There is also a huge risk of transmission of other diseases since you are injecting part of another person into the patient. Former pharmacy technician. In our narcotics safe was one 5 ml vial of pure opium tincture. Once a month we would dispense 1 ml to a patient who was going through intense chemotherapy. Third or fourth line for refractory diarrhea. Particularly for chemotherapy induced diarrhea. Really confused me the first time I saw an order for it. When I was a travel nurse, the nurse next door to me had a patient who was bitten by a rattlesnake. Was in pretty bad shape by the time they made it to the ICU because they were hiking in desert rural nowhere when it happened. The two pharmacists, which is already unusual, brought the antivenom down to the unit like they were holding the keys to the Ark of the Covenant. Seriously. They were walking slowly and one of them was holding it and the other was holding their hands underneath it. Turns out the cost was something like $40. 000 a vial and the patient needed 3 total. I didn't give the medication, but it was one of the most interesting nights I've ever worked in the ICU. And that's saying something. Not a doctor. But as a kid, I had horrible migraines that upset heavily my stomach. My pediatrician medicine for that. Liqueurum Coca-Cola. Now I realize it was a way for me to burp instead of PF throwing up. I love that medicine. Toradol. Funnily enough, they give it out like candy in the ED. But I work in the cardiac ICU and it's contraindicated in most of my patients. Not a nurse or doctor. Didn't have to administer anything myself. But a friend of mine went to hospital feeling awful and was diagnosed with scurvy. The doctor treating him got all the students to come and look at him as it was so unusual. UK. Whiskey. I had a patient with dementia who used to drink 1 glass of whiskey every night before bed. For the last 40+ years. She wouldn't settle at all without it and became a huge falls risk as she broke her hip a few weeks earlier. And was struggling with her mobility. We had a doctor prescribe 25 ml of whiskey once per day and had a bottle brought to the ward for her. It was funny signing it off on her meds chart every night. Not me but a colleague doctor. A patient of his. An old lady. Was not long for this world and her breathing was starting to fail because the nerves to the respiratory muscles had stopped working. Her family were on their way in to say goodbye but having very little time left, the doctor had to do something desperate. He had a fridge and in that fridge he had a drug that had been discontinued for years but for some reason he had saved it. Dude gave her 1 dose. Enough for her to be able to breathe and say goodbye, which she thankfully could. Absolute mad lad he was. Demerol used to be a fairly common pain med but is rarely used for that anymore. I used it once in the ED for this weird intractable tremoring that was thought to be a side effect of an experimental cancer treatment. Only used it because the oncologist asked. That was kind of interesting. Pharmacy called me and thought I had lost my mind until I explained. Also got to give dantrolene for post-anesthesia malignant hypothermia. It's on all the tests. But outside of maybe anesthesia you don't see it. So that was cool for me as well. Tuberculosis to treat bladder cancer. Not in healthcare. But my grandfather has bladder cancer and one of the recent treatments was injections of TB. I have no idea why. I just know it didn't work. I worked with a guy who had this done. It was administered via the urine catheter, not IV. So apparently it causes the bladder cancer to be surrounded by fibrous scar tissue and slowly destroyed. As the TB has difficulty leaving the bladder, it just attacks the cancer and dies out after. Theatre nurse here. There's a rare condition called malignant hypothermia, which is essentially a severe and life-threatening reaction to anesthetic drugs. The antidote is dantrolene, which is bright orange, expensive AF and kept on site at all times. I'm pretty sure there's a relatively small amount distributed across my state. However, since this condition is so rare, it often just expires. I once had to administer a certain type of blood product to a patient with an immune disorder. Each dose was worth acute 5k and he needed 3. It also was in a complicated setup. If I set it up wrong, it would be a waste and unusable. Long story short, I administered it okay with the most anxiety I've had in my 6-year nursing career to date. Fun times. Glucosidase for reversing methotrexate overdose. Was a BTCH to give as there was unclear instructions. Had to be ordered specially from the pharmaceutical company and wait for delivery directly to the ward. If I remember, was about acute 50k for a 2 ml dose. It was a while ago. But when I was a physician in the military, I prescribed dapsone among a couple other unusual medications for a case of Hansen's disease, aka leprosy, that a Marine contracted in the Middle East. I was on the medical team caring for the patient. But I remember orthopedics being heavily involved because somehow the disease was in the bone. Edit. For those wondering. In the West, while leprosy is a disease people hear about because it's mentioned often in history, it's something you learn about once in medical school and almost never see in civilian practice. I'd also add I was not the person who made the diagnosis. I just did what I was told by my attending. I was an intern.